is Tony. I'm going to be your student nurse today. I'm going to close the curtain for some privacy. Could I get your name and date of birth, please?
Ethan, August 2nd, 2000.
Ethan, do you have any allergies?
No.
Let me check your band. That looks correct. It looks like on our physician's order, we're going to be starting a saline and an antibiotic for your IV today. I'm gonna wash my hands and put on some gloves before we get started. We're just gonna start by taking a look at your IV site. I don't see any signs of infiltration, any phlebitis. It's not extremely cold, they're too hot to the touch. I don't see any edema, which is good. And we're gonna go ahead and start by just checking our medications here. So we have our 1,000 ml saline solution on our orders, and we're going to be giving that over 12 hours, so that's good. We have our ceftriaxone, and we have 1 gram IV every 8 hours for pneumonia. And the packaging and expiration dates on these two is good. We have our normal saline flush, IV every 8 hours, and the packaging and expiration date on this one is good as well. So this. We'll check the expiration date on our tubing, packaging intact, expiration date good, and our tubing and packaging for our primary line is also good. It's not expired. We will start by doing our first check. So we have our ceftriaxone, 1 gram every 8 hours for pneumonia. We have our normal saline, 1,000 mLs over 12 hours, and our normal saline flush. And this one is 10 mLs as needed. So we'll go ahead and do our second check. We have our normal saline flush, 10 mLs PRN, 1,000 mLs saline flush, or 1,000 mLs of saline IV over 12 hours, and our ceftriaxone 1 gram IV every 8 hours. Our 5 rights of medication administration. We have the right patient, right med, right dose, right route, and right time. We'll go ahead and just do one more check. So we've got our ceftriaxone 1 gram IV every 8 hours for pneumonia. Our IV natural saline 1,000 mLs over 12 hours, and our normal saline flush. This one is 10 mLs as needed. So the meds look good, and we are going to be giving our saline over 100 mLs over an hour, which is about 12 drips per minute. So we'll start by opening our primary line. Make sure our clamp is closed. This one we can go ahead, we'll open up our bag and our cap here. I'm not going to touch the inside of that. Spike the bag. And we are going to make sure prime our line, so our chamber will fill about halfway, and we'll open up our clamp here and prime our line, making sure we don't have any air bubbles. Flick any bubbles out. follows our plan. Again, go ahead. Scrub this here for about 30 seconds. Leave that under there. Cleanse our flush. Make sure there's no air in there. We're gonna pick it up. We're gonna aspirate here, make sure we're in the vein. Should be getting blood out of there, so that's good. And then we'll push and pause while we inject this. Okay. Now we can, so we're just checking for the patency there. It looks good here. Closed. We can hook that up now. And we are gonna set this at about 12 drips per minute. It's gonna be about 3 per 15 seconds. So we've got that regulator there. Now we will check the line for patency that the primary is running, and I don't see any signs of phlebitis or infiltration, which is good. Again, not feeling any extreme heat, coolness from there. I don't see any redness or edema, which is good. That's what we like to see for that. And we will be giving the cefazolin, and that is compatible with our natural saline. Our safe doses for this is going to be adults 1 to 2 grams every 6 to 8 hours, with our max being 12 grams per day. Children under a month, 75 to 100 milligrams per kilogram per day in 3 to 4 divided doses, max 6 grams a day. We use this for upper and lower respiratory tract and urinary tract infections, otis media, or skin infections. Dilution for this would be 2 mLs per every 500 milligrams or 2.5 mLs per 1 gram. And that's going to be given over 5 minutes. The rate of administration for the cefazolin, we're going to be giving 6 drips a minute. Precaution in pregnancy, breastfeeding, hypersensitivity to penicillins, and severe renal disease. We are giving this for pneumonia. Lab values to look at is your AST, ALT, potassium, sodium, LDH, and chloride. We do want to monitor for bleeding with giving this med, and some side effects is going to be changes in skin color, bloating, nausea, vomiting, sore throat, and dizziness. So we're going to go ahead and open up our second packaging here. Make sure our roller clamp is closed. We will spike our open up this. With the cap again, we're going to be careful not to touch that part there. Okay, it's spiked. And we are going to hang this one above our primary bag here. So I'm going to then we'll find our closest clamp there on the primary bag, and we will clean that with an alcohol wipe for, again, 30 seconds. Okay, 30 seconds. And we will open up this tab and attach them there. Fill our chamber here halfway. Okay. We'll bring this below the primary bag to prime the line on this here. So we'll open up our chamber and it's coming through there. Just won't flick any air bubbles. Back up. And now we are gonna regulate that here with this bottom clamp, so this top one's gonna be all the way open. And we will set this one here at about 6 strips a minute. Okay, so we'll set that at 6 strips a minute with this bottom clamp, and we can let that run. Make sure our clamps are open. They are. So that is running there, like, and to remove the IV, discontinue it, I would again have gloves on. We'd have a linen saver underneath our client's arm. Then you can remove the IV dressing carefully. You want to clean the catheter skin junction with alcohol for 15 seconds. Use a gauze pad over top of there, and without pressing down, remove the catheter along with the vein. Once that's removed, apply pressure for 1 to 3 minutes. After that, we will fold over gauze and apply it over top of there and secure it with tape to create a pressure dressing. Lower the bed. Make sure our clients are comfortable. Ask if, is there anything else I can get for you while I'm here? I've got time. Is there anything else I can get for you while I'm here?
No.
Alrighty, well, thank you for letting me start your antibiotic today. And then I would document my findings and my administrations properly.